All right, Coach Jeff here. I'm going to show you some techniques to help with some lateral ankle pain, foot pain, just some basic stuff that you can use at home and to help manage it and improve your condition. Okay, so first of all, I'm going to do breath work, and I just want to take it nice and slow, do some belly breathing. Do that for about 3 minutes or so. Just relax, try to reset your nervous system, your autonomic nervous system, go to parasympathetic. Then I want to do some myofascial work, or not necessarily myofascial work, but we want to foam roll or stick or whatever. So for calves, I like to use the stick. Works pretty good. And so for lower leg, I'm going to roll here, and you're going to do about, some gentle pressure, about 50 or 60 strokes. If you feel a tight spot, tender spot, work on that, do 50 or 60 there, and then go lateral leg, and then finally back of the calf, and then you maybe more medial inner right on the back, and then more lateral. And you're going to do about 50 or 60 strokes, maybe about a minute or so on each position. Okay. I would also include some ball work at the bottom of my foot. I like to use pinky balls, but this is a lacrosse ball, and you can use this. And I'm just going to roll the bottom of my foot and work on all that tight spots, and then just try to let your foot relax around the ball so you can do a little mobilization of the foot and its articulations, all those bones in there. Just let pain guide you. If there's pain there, be careful, stay away from it. Okay, so you want to roll that foot next. So if you're having this lateral ankle pain and your posture kind of looks like you have inversion of the foot, see, that's neutral, that's eversion, that's inversion. So people will have an inverted foot, so they're having some stuff on the lateral ankle. Maybe they sprained their ankle, did an inversion sprain. So one of the things we want to do is start to release this inner part of the calf and then the posterior tibialis. And the way I do that is, again, going back, make sure I'm getting the medial real good, medial calf, and then I want to take the ball and work right down the center of my calf, which is going to be between the tibia and the fibula. At least we're hoping we get there. And I'm going to try to release that posterior tib, which will do some inversion of the foot. So I'll get on a tender spot, tight spot, and then just hold. Use this foot to kind of stabilize. I can also add pressure if I need it. But then I'm going to evert and invert the ankle. And I can also plantar flex and dorsi flex. And then once that feels less tender, I'll move to another spot and work it there. So tibialis posterior. That comes after you do the calf rolling because it's underneath it. It's deep to those muscles. Okay, once you do that, we want to stretch it and lengthen it because it could be shortened, right? If you have an inverted foot posture. So the best tool is going to be a band, I think, or some type of stretch strap. You could use a towel or a yoga strap. Those would work. But if you notice, I'm going to pull this right side so my foot everts. See that eversion of the foot? I don't want to invert the foot. I really want to work on eversion. So that's how I'm going to stretch it in this inverted position, or everted position, sorry. That'll help stretch that posterior tib. Okay, so once Once I get that lengthened out and it looks like it helped improve my posture and my foot's more neutral, then I'm going to want to strengthen these muscles that are on the lateral side of the lower leg, like the peronei or the peroneus longus, brevis, and tertius, because they will help keep the foot from inverting. They will evert the foot. So what I'll do is I'll sit here, put my leg on top of the other foot, and then I will pull my foot into inversion, and using this band as resistance, I will evert my foot using those muscles and then come back. This isn't really doing anything. It's all this side, and then evert my foot. So hopefully what we do is we strengthen these lateral muscles. And you might see this jerky movement. Just breathe, smooth it out, go nice and slow. You might have to use a lighter band, but I'm just taking myself through that range of motion to help strengthen those muscles. So that will help, one, give you better foot posture or ankle posture where it's not inverted, but also when your foot's on the ground and you're walking, hopefully it provides and helps you with a little more stability.